Just on the UHC, I know that the council already met and there were discussions and there were agreements around the UHC staff. But two things still remain. One is we would like the CECs to help us with initiating the process so that the county public service boards could alter the contracts. The council agreed, and Katra, you should support me in this. The council agreed that we are going to pay the UHC staff as per SRC rates. True or false? And we at the Ministry of Health have the money. But the contracts are with the county public service boards. Are they with the county governments? Let me say that. All right. So I don't know whether this requires county public service boards or just chief officers, but the contract has to reflect that for the remaining part of the contract, you will be paid at SRC rates. Tumeelewana? Katra, have we understood that? So that's the first thing that we require, so that we do not pay them at SRC rates and then the contract does not reflect that, because as you know, in the country that becomes a very huge audit query. Sasa tutasaidiana hapo ama I don't think that requires a council meeting, because the council already agreed that for the remaining part we pay them on SRC rates.
E-procurement, we all got a circular saying you can't procure anything until blah, 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 blah. So when we got this, the first thing I did was to send my procurement guy for a training. What did I have to do to send him to a training? I had to procure an air ticket. Then he went to a conference room, and Kisim was asked how they procured the conference room where the more than 500 people were meeting. They were asked whether they did it on eGPS. And they could not answer the question, because even them, they had procured kienyeji. But jokes aside, when change comes in, and I can tell you, I'm an expert in change management, that is not how you implement change. You must implement change in a certain way. There are certain things you must do to implement change. But having said that, we need eGPS. Regardless of the fact that the change has not been managed properly. And therefore, it is going to create a lot of problems. No one is safe. Not me, not the Auditor General, not Parliament. Everybody is involved. Now, so what must we do? We must make the best of a bad situation. So if you are cooking a dish and you find that you have 5 ingredients out of 7, do you stop cooking the dish so people are hungry because you will say, I don't have this particular spice? No, you will still try to make a bowl of soup so that people don't sleep hungry. So can we try to make the best of a bad situation? And the first thing, the starting point to eGPS is to have a budget. Once we have the budget and it is on IFMIS, please register with the system. Register the people who are going to operate it. That is already, you are like 40% of the way. Then before you know it, if you have, I'm told the procurement plan is online. Please go ahead and do it. Do not keep protesting, saying it is going away. It will not go away. It is with us. People complained about IFMIS. They have been complaining to date. As I speak to you, people still complain about IFMIS. Did we stop using it? Please get used to EGPS. We are all in it. The sooner we start using it, the better. That is my position.
Things that were left that were supposed to be discussed today when probably CS was here, or the PS and the SHA leadership, but unfortunately they are not here. So you might not be able to answer all of them, but it is good for you to know as the accounting officer for the whole of the Department of Health on some of these issues. Are they going to be projected, or did I speak off the cuff? There is quite a high amount of money which has been rejected for payment, and yet the reasons have not been given by SHA. And the concern is that these services which were offered from the MES, as SHA rejects to pay these bills, what happens to the KEMSA and what happens to the MES, NESP, the NESP bills which are coming? Because if these bills are going to be taken from the headquarters as is envisaged, then the counties might actually get zero, because everyone... Many primary healthcare facilities, we are talking about preventive health, and preventive health is about level 2 and level 3 facilities. A good fraction. Talking about Kisumu, I saw my governor telling me to draft a letter. 50 out of 150, and 42 out of 150 facilities. I've never seen a single call asking for, not in millions and billions, but they make a very big difference. The second thing about the level 2 and 3 facilities is, I think that was already resolved at council, that deliver emergency fund which is going to be rolled out. The caucus felt that the emergency centers which have been designated cannot get an accident and you start bleeding. You will be taken to the nearest facility, whether it has theater or no theater, because there is a clinician who might be able to. So these have not been totally been related in the emergency care, which talks about only level 4 facilities with a theater. It is pre-approved, it is sent for payment, and then the payment is cancelled at the last minute. After all that, even though we were told that audits can happen at any one time, but the argument is that most of these are public facilities, and what really should have happened is that these are the things that you need to connect, because services actually occur, particularly surgical services. You know about this, the issue of bed capacity. There was no transition period. We were told of some facilities which are way in the semi-arid areas where there is one facility for cancer. But you have found that there is cancer inside here. The surgery totally changes. So that doesn't make sense. So then some of those things are removed because somebody went in, I saw a case, they went in to do a hydrocelectomy, which was rejected the hernia. So you were told, no, you're authorized for hydrocele, but you have done a hernia. So then this cannot be paid. Point number 11, the SHA system, I don't know what I'm not using, indicates payments have been made to facilities, but those facilities have not received the funds. So in the platform, money has been paid, but in the bank account, money has not been paid. Had been paid 7 million shillings. And they found, when they went to SHA, they were told the 7 million shilling was paid to Outspan Hospital. At least I remember the word Outspan. And so they were told to go and recover their money. Finally, we are not transferring it. And so that particular facility lost that 7 million because it was sent to a wrong facility. They are shut out of the healthcare system because the money